We are in webinar format, so if you do have any questions or comments throughout the presentation, please go ahead and utilize your chat. And you can find the chat by kind of hovering your mouse at the very bottom of your screen and clicking on the chat icon. If you don't see it, you may have to click on the little three-dotted menu to expand a bit. And you do have the option to chat folks privately in the chat. Just be sure that you're chatting everyone so that we all can see your messages and your comments. Again, I do want to remind folks that we are recording this session and that we will share the recording with the appropriate parties. If folks would go ahead and open up the chat and just send us a quick hello just to make sure it's open and working and that you all can see everything. And of course, if you have any technical issues, please go ahead and shoot us a chat message or you can private message me as well. My name is Tiara and I'm your tech host today.
Thanks, Tiara. So we would love for folks to, can you hear me first off? Maybe Philippa can nod if you can hear me. I think I can be heard. So yeah, so let us know who you are, in addition to just saying hi. Who are you and where? I can see your names. Jessica, Don, Brooke, Vanessa, and a whole bunch of other folks. Where are you joining from? What is your organization? That would be really cool. Who are you and who are you representing? So thanks to Leanne from New Mexico and Michelle from Colorado. This is fantastic. So I'm just going to get us started. So I'm Eric Bruns, and I'm here at the University of Washington in Seattle. And I'm joined with a representative of our partner organization in this project, Philippa Hoover, who is, I believe, in North Carolina with 3C Institute. Those of us who went to other ACC schools will forgive the North Carolina UNC kind of representation. We can join forces. I went to University of Virginia, but anyway, so this is a webinar about our newest resource that we've been developing at the National Wraparound Initiative, National Wraparound Implementation Center, and Wraparound Evaluation and Research Team called SmartWrap. So SmartWrap is an acronym for the Short Message Assisted Responsive Treatment for Wraparound. And as we're letting folks join and let us know who they are, just a little bit of introduction to what the inspiration for SmartWrap was, which is that, the National Wraparound Initiative way back in 2003 or so, when Janet Walker and I launched it 20 years ago, kind of hard to believe. Our whole point of launching NWI was to have a resource be available for the national field of wraparound care coordination and systems of care, where folks could contribute their expertise. Back 20 years ago, it was just about defining what wraparound was so that it could be researched, fidelity could be measured, and so forth. Over the 20 years, we launched the Wraparound Evaluation and Research Team, which is here at the University of Washington when I came out here. And so UW-WIRT has created outcomes measures, fidelity measures, data systems. In 2012, we launched the National Wraparound Implementation Center, or NWIC. And this is a resource for the field in the form of training and database coaching, technical assistance. So the whole point of these entities that we've launched is to learn from others out there in the field. Nobody owns the wraparound practice model. This is something that is about us and our families that we work with, the family advocates, the family-run organizations, behavioral health organizations, care management entities, and the families and youth that we serve, sharing together. And so the SmartWrap system is kind of the newest of a number of different innovations that we've put out there. Everything from communications about what wraparound's inclusion on the Family First Prevention Services Act, or FFPSA, means for the child welfare field that wants to do wraparound, meta-analyses done by our colleague here at UW-WIRT, John Olson, that help the field understand that wraparound is evidence-based. 16 controlled studies later, we know that's the case. And most recently, or more recently, we've created a system called WrapStat, which compiles both fidelity and outcomes data for your full roster of young people to help with evaluation and quality assistance. And WrapStat, for those of you who have been using our fidelity measures and are on WrapStat, was co-created with our friends at 3C Institute. And so about a year ago, we applied for a grant from the National Institute for Mental Health to create something called SmartWrap. Again, short message assisted responsive treatment for wraparound. So what we're going to do today is talk a little bit about what is SmartWrap, how was SmartWrap informed by the community of practice out there for wraparound, including probably many of you who are on this webinar here today. Thank you for your contributions. We did an initial pilot test of this text-based fidelity and outcomes monitoring system. We'll tell you a little bit about what we learned. And the next thing we're doing is we're going to have a bigger, broader pilot test of the system. And we would like you and any of your organizations to be involved if you would like to be. And so that's the main purpose of this webinar, is just to let folks know, and we're recording it so that we can also share it with others who might not have been able to be here today. How do you get involved in piloting this text-based fidelity and outcomes monitoring system? So thanks to all of you for being here, seeing folks from New York, Tennessee, Arizona, Oregon, Texas, Michigan. This is the great thing about Wraparound and our community of practice and about the National Wraparound Initiative, is that we are truly a national community, learning community and community of practice. So Pippa is here from 3 Institute and myself from UW-Wirt. Philippa, if you would like, or Pippa, if you'd like, feel free to put yourself on video and just introduce yourself, since you are our partners in this project. Can you say hello to the national community of practice?
Sure. Hello, everyone. I'm Pippa Hoover. I'm a research and technology specialist here at 3C Institute in Durham, North Carolina, and I'm the study coordinator for this phase of the research. So I'll be handling a lot of the data collection. Yeah.
Thank you so
Anything
much.
else I should have mentioned?
No, that's great. Thank you, Pippa. So Pippa has got a great team there in Durham. Melissa DeRozier is the CEO of 3C Institute, and it was she and I that cooked this idea up, because frankly, what we realized here on the wraparound side is that it is very challenging to get data about how well wraparound is working for families, and we need to make it as easy as possible. So that was the inspiration for putting this small grant proposal into the National Institute for Mental Health, was to allow there to be a better way that's kind of in the actual 21st century for getting data from parents, from caregivers, from youth, from young adults about how well their wraparound is working for them. So what SmartWrap is, in a nutshell, is this is something that the behavioral health field and the IT fields call an MROM system, a mobile routine outcomes monitoring system. So that's the fancy terminology you use out there in the literature and in your grants. But what it really does is it's aiming to assess wraparound quality, fidelity, satisfaction, and outcomes in the least burdensome way we can think of, which frankly is text messaging is our idea here. So what it does is it sends caregivers and older youth and young adults. So I think we are limiting the age to 14 or older for the young people, maybe 13 in this first trial. We'll see how well it works for them, as well as parents and caregivers. And it sends them really brief text-based outcome measures and satisfaction fidelity measures. Literally 4 items at a time is our thinking. And I'll tell you what the domains for the items are in a second. And again, the project is funded by NIMH, which is always very cool, because we get our tax dollars funding important things for our kids, families, and providers. So a little bit more about why SmartWrap. So we know all too well here from doing this for 20 years that our fidelity and outcomes data collection and wraparound can be very inconsistent. We can get very poor response rates. We know this from using WrapTrack. We know it from using WrapStat, our 2 systems that we used over the last 10 years or so. You get people out there who are evaluating wraparound. They might be trying very hard to get good response rates, and they get 20, 30%, 10% of all the families. And then they say, look, our Fidelity is great. And the reason it's so great is that you got the 10 of your 100 families that were eligible that were the easiest to contact. And that is not rigorous. That is not something that gives us data that's useful. We did a webinar that you can go find on our webinar page. I think it's already been done. Tiara put the NWI website in the chat, nwi.pdx.edu. You can go there and find that webinar on how important it is and how you can get good fidelity and outcomes data collection response rates. This is trying to push to another level. So SMS, short message systems, can address inconsistent or incomplete data collection because the behavioral health and health fields have found that text-based data collection is doable. You know, unfortunately, we're bombarded with these things, right? But we do know that text-based surveying can be more effective and get more complete data than any other method, even though increasingly, you know, your oil change guy and your primary practice physician and everybody else is sending you these. It is a more reliable and feasible way to get feedback and information. The research shows that short message system monitoring is very clinically useful for those who are working directly with patients or clients or families and youth in wraparound. It can enhance mental health or health service delivery by care providers because you have the ability to ping folks, and within 20 or 30 seconds, you've got the data that you might need about whether or not this individual is responding to whatever your treatment is, whether it's health, behavioral health, substance abuse, whatever it may be. So research shows that it's very clinically useful. And so we want to build on that research in the wraparound field. And we've also found that if you are consistently asking folks to give you feedback through short message system, SMS messages, research also shows that it can increase treatment adherence by asking, you know, are you doing the things that your treatment, whatever it may be, is asking you to do. Could be about a health intervention for, you know, nutrition, weight loss, substance abuse, that by getting this rapid, brief assessment of how folks are doing, you can tailor and customize how you work with that individual. If you're a supervisor and you've got 10 care coordinators or 10 nurse practitioners or 10 mental health therapists, whatever it is, you can look at the data and say, okay, we've got pretty good response rates across your 10 clients. I see that 8 of them said that they're doing great. These 2 are not making progress. Let's talk about those 2. Let's not talk about the crisis of the week. Let's not talk about, you know, how this young person acted in the office on the day they came in. Let's talk about their actual outcomes as reported by them or their parents. And so doing this in this way can increase quality of care and outcomes by making the provider responsive. And also because it's low burden, there's suggestions from the research that it can be a way of overcoming health disparities, because this is lower burden than other ways of getting information from your clientele. So what is Smart Wrap as we've designed it in this very early prototype measure? So our best thinking is that there's 4 different domains. One is caregiver alliance. So one of the pieces of the theory of change of wraparound is that if you have a care coordinator that really gets to understand you, understand your needs, develops plans around those needs and their understanding of how you came to the attention of the wraparound initiative, there can be a better alliance, which is a huge thing for parents and youth who have been through the system for many years. Is you need someone you can trust, who you feel like understands you. So an example item that would be pushed out through the text messages, my care coordinator and I agree on the goals we're working toward. A little bit further down the theory of change, there's satisfaction and engagement. So I am satisfied with the help that I'm receiving. When you see someone saying no to that, you know that something's not going well and you need to get in there and do something different, right? And then of course there's outcomes for both youth and caregivers. An example item we're testing out is wraparound has helped reduce my stress. Try to keep it very simple. Don't get into the technical stuff around behavioral health treatment or even wraparound. Does it help? Has it helped me? Has it helped reduce my stress? And then finally, optimism and something specific to caregivers. So a big piece of wraparound is it's not about necessarily just treating the youth, it's about providing supports for the parent or caregiver so that they can do, so that they're able to do whatever it takes on their side to keep their child in their home and community, no matter how challenging their needs are. We have to support caregivers and parents. So I feel confident I'll be able to care for my child at home in the future would be an example. So these are the 4 domains. All 4 of these domains have items that go to parents or caregivers. Right now, for the system we're working, we'll find out whether it worked, if this is good enough. For young people, based on our first round, we were just asking about satisfaction and engagement and outcomes, not getting into the depths of alliance. And this is, as we'll see, from the youth themselves that we did focus groups with after they tried this out. They said, you got to keep this really simple. And so right now, the next version we're testing will just focus on their satisfaction with what they're getting, whether it met their needs, and their outcomes. How am I doing? Do I feel like my mental health is good today? So backing up a little bit further, and by the way, I'm going to pause maybe in just a minute, and it looks like there's already some good questions coming in. Are these measures meant to supplement or substitute existing measures from other Fidelity tools? I think that's something we're going to learn. That's what we're going to learn here, because we're going to integrate these with our current Fidelity system, and that will be an empirical question. That'll be a question that we'll ask over time and in this next round of Fidelity, and then this next round of testing. So that's why we want to put this out there as an opportunity, so we get a good number of organizations that try this out with us in this research grant and see if it's good enough to serve as a substitute for what we're currently getting, because we can compare the data we get from SmartWrap to other data that we get from more traditional methods. So point being, put your questions into the chat and we'll check in on them periodically as we go for the next 45 minutes. So backing up, where did we get the items in the first place? We did a review process with, I think, about 80 people out there in the field: parents, parent advocates, youth advocates, providers, managers, agency heads. So we got these experts in the National Wraparound Initiative Community of Practice to rate draft items we came up with. They proposed wording changes. They defined or helped us think about how would we know when to alert the provider, the care coordinator, the supervisor, and do an outreach message saying, there's something you need to intervene with here. There's a parent or a youth that's struggling. They're not making progress. They're not satisfied. Their outcomes don't seem to be good right now. So we defined what those benchmarks would be. We did this across 2 rounds and got ratings as we went. The ratings of how good the items were and how good the wording is went up. And so we used that first bunch of information to create the first prototype. So this was an example of how this worked, this Delphi process we went through of getting input from the field. So we just put out there a proposed item. My care coordinator and I agree on what we're working on together. Do you think that this item is essential, optional, or a bad idea? And this one got very high ratings of essentialness, right? So I believe that this is in the current system as we're about to do the second round of testing, because people rated this as being an essential. As you can see, as proposed, a good almost half of the folks said, you need to revise this a little bit. Here are my suggestions. And so we did revisions and we put it back out there, and we got higher ratings of the acceptability of the wording. And that's, again, now the items that we're testing out in the next round. So I'll just show you a little bit more data and then we'll get to some questions. So just as an example, Fidelity items that we originally proposed got rated very high in terms of their essentialness. My youth and family have a team that meets regularly was the lowest, but it still got 92% of our experts saying this was an essential question to ask. My youth and family have a plan. My youth and family has a team of people. These were core Fidelity items that people said it's essential that you ask to make sure this is happening. Our experts were a little bit less unanimous on some of the alliance and engagement items. So, you can see that one item Actually, it was only rated as essential by 59% of people. And this was, my youth's behavior causes stress or strain to me or a family member. Folks weren't as enthusiastic about that. And for some others, they said this is an essential item, but the wording could be improved, and they gave us suggestions. So this is the way we got to the first version. Finally, the last couple of domains, symptoms and functioning. And again, like I said, caregiver strain and optimism. Were these items essential? And then was the wording adequate? And we got ratings on all of these, and that's how we built the first version of the system. So just kind of showing you more, not getting into the details, just showing you how we got to the first version of the system. And the last piece of data I'll show, and then we'll pause here. We also said, well, what else could this system do? We haven't even built the system yet. We're just trying to get input from the field. What else could a system like this that's based on short messages, text messages, what else could we do if people agreed who were receiving Wraparound, they wanted to sign up and be part of it? The biggest thing that we put out there that people said that this should do is, maybe not surprisingly, because we said we would do this in the original grant, but we wanted to test this, make sure it's true. Most important on average is alert wraparound teams or providers when a caregiver or youth gives a rating that indicates a crisis or a poor outcome that needs intervention. They said this is the most important thing this system can do. Other things were rated lower. Doesn't mean that they weren't good ideas. They just weren't rated as high of a priority. Some things that were other priorities that they said could be important is help supervisors review data so that they can work with their care coordinator on the right families that need help. Provide a way for care coordinators to communicate with caregivers and youth. We didn't plan to include that, but that was the second highest rated function. So maybe this would be something that we could build that functionality into down the road as well. We'll find out if 3C thinks that's doable. There will be a lot of issues with confidentiality and security, obviously, that would be required there. So these are the kinds of things we got information from the field on originally, and that helped us refine the items and how SmartWrap would work. So we simplified the language. That was a big thing we heard from youth and parents. A big thing, as I'll show you, is that we proposed that there would be automatic replies that happened depending on what your response was. People didn't like them. They didn't like how many there were over the course of doing your surveys on your phone, and they didn't like the tenor of these. It felt too canned. It felt too automated, robotic. So we're trying to fix that. We did hear from the youth and parents that gave us feedback. We heard from them that they felt like this is a very important thing from their perspective, because youth and parents need as many easy, low burden ways of giving their feedback as possible. So these were just a couple of the many quotes we got from youth and families about the system as we tested it out. I think this will be very helpful for care coordinators and family partners. Real-time feedback will improve Wraparound and hopefully overall progress. I just want to say thank you so much for considering my feedback as a parent with lived experience. I appreciate the team's willingness to try your best to get it right for us. So we're encouraged because we got a lot of messages like that. Okay, maybe we will pause because now we'll talk about the second round of testing and then talk about people who might want to be involved in the third round of testing, which is what we're looking for more sites to do. So let's see. Anyone, I don't know, I guess Kobe never joined. Let's see. So I see some good, we talked about from Tito's question about measures meaning to supplement. So again, I think we're going to test this out and we'll find out using both kind of user experience feedback as well as analyzing data. If you did both these very brief text-based outcomes and satisfaction measurement, does it get you as reliable and valid a data as something that's more traditional? We'll learn about that. I'd like to think that it might work that way. So we will do our best to learn that so we can answer that question, Tito. Are the measures collected at different points? So thanks for that question. Yeah, so I don't think I went into that. Maybe it will in a couple slides, but so here's the answer. So the idea here is that you would get very brief assessments over time. And that would inform the organization, the supervisor, the care coordinator, depending on what level they're working at, how well individual families are doing over time, as well as the whole program. So you can aggregate it up very high, or you could just look at your families and ask, how are they doing? And the idea here is to make it very brief and fairly frequent, every couple of weeks. In the testing, Pippa, maybe you can remind us, how often in this research study did the caregivers and youth in the last round get their text message assessments?
So in this last round that we just completed, there were 4 text messages that went out over a 2-week period. So it ended up being approximately twice a week. In the round that's coming up, that timeline is going to be stretched out more so that they're receiving the text messages once a week.
Yep. So, you know, the research study is just, you know, it might be different than the way it's used in the real world. But right now, you know, our thinking is ping out a small number of very brief items once a week, aggregate that up. And, you know, over time, we could ask, what's the sweet spot, right? A couple more items less frequently, less items more frequently, we can assess that. So right now, our best guess is we're going to try 4 items once a week, and you'll see just how fast it turns out people could do that. Let's see. I think, are there any other questions from anyone on the webinar from the team that I missed? I don't think so.
I don't see any questions. Oh, wait, we just had one come in. 2 come in. All right. Amanda. Sorry,
Oh yeah, response
work
rate
with-
was a struggle. We get it, Amanda. That's what, and that's another thing we can test, right? So an organization, I don't know where you're from, Amanda, but thanks for using the tools. Maybe, you know, we're going to use items from the Wi-Fi Easy will be among those that are assessed for Fidelity. Perhaps this will get you better response rates. We can ask that question. Hi, Kobe. You want to introduce yourself?
Hi, everyone. My name is Kim Coviello. Everyone calls me Covey. I'm the Assistant Director for the National Wraparound Implementation Center. And nice to see everyone. I recognize a lot of names in the chat. And so I will also be helping to monitor the chat.
Thank you, Kobe. Kobe is the real expert on wraparound because she trains it, lives it every day. Those of us who are just researchers are doing our best to learn from folks like Kobe about what the field would benefit from, and you all. Will this take the place of the DART? So the DART is a much more intensive fidelity tool. I don't think this would ever take the place of the DART because the DART is a way of really getting in deep. You don't have to burden families with the DART because you just take the documentation that's been collected in implementing wraparound and other services and say, what does this tell us about how well we're doing? So it could, you know, be a better way to get outcomes, which the DART, the Document Assessment and Review tool, one of our suite of fidelity measures, does assess. Could be a better way of getting outcomes because it's coming straight from the parents in real time, but it serves a different purpose. I think what would be more likely is that this could, you know, supplement, maybe somewhat replace satisfaction and maybe even certain kinds of outcomes measures. Leanne says, have you considered matching the types of questions based on the phase of wraparound the youth is in? So that's a great point, right? So right now we're just trying to get proof of concept that we can even do this and that people will do it. But I think that as the system is developed and evolves and we blend it in with RapStat, that could be the kind of thing that it does, right? So at this phase, we're just trying to see if we can get good data reliably, more reliably perhaps than other ways. And if so, we can evolve it further. But that's a very good point that we could do that. And, you know, I'm sure 3C Institute could figure out how to make the questions line up with how long they've been enrolled. RapStat, as you know, is intended to get a full roster of all the kids that you're serving, all the families you're serving. And so knowing when they were enrolled, we could time the texts to align with the phase that they're at, which would make total sense. You wouldn't want to be asking about long-term satisfaction of someone who's only been in for a month. But at 30 days, they should have been engaged. They should have been working on an initial plan of care. And so what we see from the DART, because we look at in-depth data from documentation, is that sometimes families don't even truly get engaged and plans don't get developed until 45, 60 days, 3 months sometimes. If you sent a text message at 30 days and said, how are you satisfied with the way in which a needs-based plan has been developed? And they said, there is no plan. Then you would know, you'd be saying, this person is responding to text, but they say they don't even have a plan of care yet. What's going on? So a lot of ways that could be done. So appreciate that point. Is Wrapstat the anticipated data repository and reporting software? So that is our long-term goal. As I'll talk about in a second, the short-term goal or process will be to create kind of a unique, very bare bones, and Pippa can talk about this a little bit if she wants, but very bare bones kind of dashboard for the data that's being compiled. But our long-term goal, once we learn whether this will work, is to blend it in with Wrapstat so it's all coming out of one system. Would you agree with that, Pippa?
Yeah, it's definitely a goal to make the system compatible with Wrapstat. It's yet to be seen like exactly what that will look like. At the moment, what we're building is going to be a standalone system, but we are definitely thinking about how it can integrate into Wrapstat in the future, because that's definitely a goal.
100%. All right, well, let's take a look at a few more things, and then at the first wave of user testing, and we'll go back to questions. So here's what it would look like from a family perspective, right? So this is what it would actually look like on their phone. So pops up, and we got lots of good input from focus groups about how to improve this, but this was as it was first tested out in our first very brief round of user testing. Your care team, and we learned maybe we shouldn't call it care team, is very interested in getting input on your family's experience. Please click the survey below. Should take less than 1 minute. And as we learned, it does. So you just literally click on the link, and then what pops up is a separate secure, because texts aren't necessarily secure, right? So what comes up then is a secure interface on your phone with the items themselves. How much do you agree with the following? I'm satisfied with how Wraparound's working. Not at all, sometimes always. We got some input that maybe having a little bit bigger range of options would be better. So we're going to try 4 response options for the next round. But this is the way it looked in the first. So you click, hit next, do 3 more items, and you're done. Now, when you do your first item, this is what came up. If you said, I'm always satisfied, a little pop-up came up that said, hearing from you about your satisfaction is important. Wraparound care coordinators should regularly check in with you about your satisfaction with the process. Knowing about your satisfaction will help us improve in the future. If you said no, not at all, our first guess at the automated response that popped up is same thing, but then it says, if you're feeling unsatisfied with how well Wraparound's working or not being asked, you may want to raise this concern with your care coordinator, a supervisor, or someone else. The families we talked to did not like this. They said that to be told that, one, they didn't like these messages in general. They felt robotic, canned. That's not the way Wraparound's supposed to be. So it kind of wasn't received very well. The other thing they said is, if it's not working for you, you're probably not going to go to your care coordinator and tell them. So what they suggested is, maybe the secure anonymous interface can give you a place where you can submit anonymous feedback. So we're going to try that out in this next round. The youth or caregiver will get an option to either say, I want to send this note to my care coordinator, or you can send an anonymous piece of feedback to the organization. We'll see how that works. We're all learning as we go here, but this was all based on some really cool focus groups we did with caregivers and youth. So we didn't like this, we're improving it. One of the things that was very encouraging was the 16 testers that we got Doing a 4-item survey, even with those automated responses popping up, only took 30 seconds. At the beginning, it took about a minute, then about 45 seconds, and now 30 seconds by the third time they did it. We saw the data. It was pretty cool. So, and 86% of the messages were opened. Now, we know that these are people who agreed to be part of a study. So we're hoping we can even get close to that in the real world. But in this test, that was pretty encouraging. 90% of the caregivers and youth said they agreed the system was easy to use, and all 16 strongly agreed they were satisfied with the system and that it didn't take too much time. So these are some good initial results.
Eric, we had a couple of questions just before you move on.
Yep.
One of our participants wanted to know if this system has been tested across multiple carriers, including smart versus non-smart phones.
Ooh, that's a good question. Pippa, do you have an idea about different kinds of phones or systems or carriers?
So the only eligibility requirement is that you have a phone that is able to receive text messages and access the internet. So whatever phone they have that fits into that category, if they were able to sign up with it, then we tested with it. So we didn't collect data on like what kind of phone they were using. However, based on that criteria, like if their phone can't access the internet, it's not going to be able to use the system as it is currently set up.
Great suggestion, though, to ask folks to tell us what carrier they have so we can confirm X number of carriers were involved in the study and they all worked, or maybe one won't work, who knows? But that would be a good thing to include. That's a really good suggestion. In terms of the flip phones, right, I do remember when I was, younger and you had a flip phone, there were things that you would get in surveys and you would literally put in one.
Right.
So but I think that without being able to access the internet, you probably can't have a secure survey interface, probably, correct, Pippa? So it might be a research question.
Yeah, I'm not on the dev team, so I'm not sure the answer to that, but my suspicion is that no, you can't make it as secure without that.
Yeah. So in terms of whether or not when we get out in the real world, which we could start to do in the next round of testing, because the first round was very, like just trying to figure out if this is even working. We could ask about whether folks enrolled in Wraparound don't have phones that would work for this. We can learn that. And we can also learn, as Janina asked, if the charges for texts will be a barrier, because I think all of those things could be barriers, and we'll need to do maybe what we should do. So this is all why we do these kinds of webinars, right? Get a lot of good ideas. So we should probably, as you'll see, we're asking for 10 wraparound provider organizations. So with 10 across the country, we could probably have a little bit of an overlay where we ask the administrators from each organization to tell us a little bit about do you anticipate there will be barriers given the and for what percent of clients would this even work?
Yeah, I think that those are all great questions.
Mm-hmm.
A couple of other questions that came up, Eric and Pippa, were talking about any incentives. So were incentives used initially, or have they been considered to try and increase response rates for youth and families?
Well, we certainly used incentives for the research, and we will continue to. So that creates an issue, right? Are incentives going to be used in the real world? Is it mostly that we're getting 86% response rate because folks are getting incentivized? That'll be the kind of thing that in a sequence of research studies, you make the testing, you go from being more artificial and just making sure you have proof of concept to real world testing. And that would be one of the things we would ask is, do you need to incentivize? We advocate for folks to incentivize when people are sent to the internet to do our surveys, or they respond to a phone interview or a paper and pencil survey. We ask and suggest, give a small gift card. You got to give a thank you. if you want to get good response rates. So it'll be an interesting question if that could be easily done, maybe even through the app. I don't know.
Mm. And then there were just a couple of other thoughts and ideas, especially since more and more people are returning to those flip phones. Could there be a computer option in terms of being able to take the survey if you don't have a smartphone that can access the internet?
So if there's a trend back to flip phones, I want to be part of that first.
There's a little trend happening back to flip phones, Eric. I don't know. I mean, I'm not sure that we're gonna probably be able to make it over there because we have so much we have to use our phones for these days. But those who don't, they're going back.
Yeah, we will have to ask that as a research question. I'm not going to put Pippa on the spot because, like she said, she's
Yeah.
not part of the dev team. So unless she has some ideas about how this has worked for other apps in 3C, then I would say we're going to have to learn how best to make this work.
Mhm.
I mean, our survey platform definitely has the capability to work on the computer. That's not a problem, but I think that within the scope of this study, it might be limited to the text messaging, but moving forward, that I don't anticipate that being a problem if that's something that people want to consider.
Mhm.
Sounds great.
All right. So it sounds like all of those are options that we can explore moving forward.
So this is fantastic. I love, again, this is why we take the time to do these things. This is what NWI has always been about, is getting input, sharing as we go. So we did focus groups, and that was the way we did it with those who tested it in the first round, right? So some other pieces of input we got. Parents said satisfaction and fidelity items should specify the time period. We didn't do that, as you saw from the example. They said, and this is a big problem, go to our blog and you can see all sorts of people talking about this. If your care coordinator turns over, you might have a terrible experience and then a great experience, or a great experience and then a terrible experience. So the parents said, make sure you say when you want us to tell you how things went, because it can change over time. So that was a really good piece of input, and we've changed the items to say, over the last 30 days, how would you rate your satisfaction? Youth said to simplify the items, which we've done. We've tried to make them super simple for the young people now. Youth suggested using emojis. So we're adding that to all the response scales. I think we are. We're going to try. So big smiley face, little frown face, big frown face, right? So, when you go into an airport bathroom, they have a little thing that's, you literally just hit a smiley face or a frown face to say, I do that. Why not? That's easy. So same thing, I think, same principle applies here. Parents and youth said, a lot of these texts came when I was in school. Make sure you time it at a time that makes more sense. Maybe we would even be able to let folks set themselves up in the system to say when they would prefer to get them. Care coordinators should help families at the front end. So they gave us some good input about, they would get a text and it would come from a number that was like spam. So what they said is, when you actually start using this out there in the world, it should be part of the engagement process. Like, this is not just some separate thing. We need to know, from care coordinator, someone hopefully, or family partner, hopefully someone who's trusted. We're going to want to know how you're doing, even when we're not working with you, which, could be weeks at a time at certain points. We want to make sure we know how things are going for you. So here's the number you're going to get texts from. Set it up in your phone, so that could be part of the thing that gets part of the engagement phase even. So we got great input. So what's next? So based on those results, we changed the survey items. We're adding reminder texts. We're revising those auto-generated responses to not be as robotic and not be as come with each item. It's going to come at the end of all the 4 items that you get. Boom, 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 boom. Theoretically, that'll reduce the time even more than 30 seconds, which would be kind of crazy. 15 seconds. And we're adding this thing that, as people suggested, allows you to put in some open-ended feedback, either to your team or anonymous. You don't have to do it, but this was a suggestion, and so we'll see how that works. And now we're asking for additional pilot test sites. So that's our ulterior motive of having this webinar, is if folks want to know how they can be part of the next round, which I think there's representatives of some organizations that are interested here. If not, we can send them to this recording. So the second round of testing will further refine the tool itself and this first version of the provider dashboard or reports that Pippa was talking about. So we're seeking 10 organizations. Already got 5, so we must act now. We might take more than 10. I would just go ahead and say that if you haven't already reached out to us, put your name and contact information into the chat so that we just know to go find you. Because folks might be on this that didn't even see the original call. So yeah, please let us know if you're interested in being a pilot site. Or you can tell us who your supervisor is and they can tell us, or whatever, right? So we're seeking 10 provider organizations. Each site would do the following things. Just identify 3 care coordinators in your organization that would be involved. Each one of those 3 care coordinators would just identify 1 family to try it out with. It could be just a caregiver, or if the young person is old enough, I think 13 or older, and has a smartphone, they could be one of the testers as well. So the organization will identify 3 care coordinators, probably just 1 ideally, could be more than 1 if necessary, supervisor who oversees the work of those care coordinators, and 1 manager or administrator who can tell us how they thought this worked for their staff. So 3 care coordinators, 1 supervisor, and 1 higher level manager. And if the supervisor and the manager, if you're a small organization, is one and the same, that's fine. So like we said, every care coordinator will obtain consent to contact for 1 family to participate in the study. You won't have to consent the family or the parent. You just refer them to us and we do that. So you're not the folks who have to do that. That's our job. So we will then reach out to the parent. It's ideal that, well, it's not ideal, it's required that you get their permission for us to contact them. So it's called consent to contact. But each care coordinator would do that for 1 family. So we're hoping for 3 parents or families or youth, one or the other, parent and youth, or youth or parent from each organization that participates. And each of those folks will participate in the testing. So the parents or caregivers and the youth will get these text messages, like Pippa said, once a week. They get 4 items. Again, it should take less than a minute. The care coordinators and the supervisors will use that back-end system to see how well the parents and youth are doing, caregivers and youth are doing. After it's all done, all of those folks will tell us how well it worked, using some online surveys as well as interviews or focus groups. Pippa can tell us anything more or answer questions, but this is, again, a secure system. Doesn't use the actual SMS to do the surveying. There has to be a link to the internet. So that's a barrier perhaps for some families, but it creates this secure platform. What we will do securely is to track logins, response time, how long they've been in the system, what kind of help requests we get from the 10 organizations. So we'll track all that stuff, but the system is secure. And like I said, the pilot testers will rate how well the system worked for them. Some examples are, was this easy to use? Was this a satisfying process? Did this seem like it was worthwhile? Was it practical? Did it come at the right times? Did the text come at the right times? And then the supervisors and the managers can tell us, does this seem like it's adequately valuable info to actually use this in the real world? And finally, how do we think this might integrate with your existing systems. That's a little bit higher level, higher order kind of thing. But we would ask the managers and stuff, well, what do you think? How might this work with your existing EHRs or whatever? And there will be incentives. So the caregivers and youth will receive $60 just for doing the text messages and doing the survey at the end. If they participate in a focus group or interview, they'll get an additional $100. Care coordinators will get $100. And as a thank you for helping recruit and using the back-end dashboard, we'll also send the supervisors and managers a $100 gift card. So folks are already sending info. I hope we can easily get the output from the chat. We will reach out to everybody who says they're interested and let you know what the next steps would be. Pippa, I think isn't the next step for interested organizations will be in a little kind of more in-depth orientation from 3C about how this will work. What happens for, what are we doing next with the interested organizations?
Like officially begin recruitment, we should be sending out emails to interested people. So that would mean to managers, supervisors, and to care coordinators. And you would need to follow a link in that email where you're taken through an eligibility survey and a consent form. And then following that process, if we are able to form enough consented people into a care team, then there will be a study orientation meeting for the care team members. And at that point, we'll both go over the study and what you'll be doing as research participants, and also talking about how you're going to help us recruit families, because we do need the care coordinators to identify the families and who we should contact before we are able to contact them, and to collect their consent to contact. So that'll be the purpose of that meeting. But that's kind of the flow. It should start with an email, then a meeting, and then you help to recruit families. Yeah, did that answer the question?
Yeah, and I think in the shortest term, I don't know if Leah wants to turn on her camera, but Leah Musmecki from our Wraparound Evaluation Research team is our research coordinator on this project here. And like Pippa was saying, confirming that you want to participate means that we would make sure we would have to get the emails, not just of all of those folks. So your supervisor, your manager, and your 3 care coordinators. And when we have confirmation that all those folks are ready to be reached out to with that consent form to be actually part of the project, then we know it's a go, and 3C would take it from there. But in the shortest term, Leah, who's on the webinar here and will get this list of interested folks, will be working with you to make sure all your questions are answered and to get all the emails from the relevant staff, because it's you know, like we said, it's going to be a few folks in your organization who would have to participate. All right. Well, that is the end of the little review of this project and the system and this our outreach, our request for help. So I'm looking now here, let's see, thinking about the data analysis process. Will we be able to download data, analyze, and create reports? So it will be very similar to the way RapStat works with our Fidelity online Fidelity data collection and reporting system, right? So the data would come in via a different method, but what we anticipate is there would be canned reports that you can get access to based on the data that gets collected in your site. Ultimately, the system would then also allow you to export the data, do your own analysis and reports. Probably there'll be a report builder function, just like in RapStat that's getting built now, where you work within the system. You don't have to necessarily just export it out. You could probably define the parameters and look at data by different, cut the data in different ways. But that'll be all down the road. So that's answering Steve's question. Jennifer, thank you for looking into it. So you can email Leah or the team. So lrm94@uw.edu. Rapival@uw.edu is another way to get to us. So thanks, Jennifer. Do you have an estimate how much time the focus groups will retire? Our last ones were like 40 minutes. Not super long, but especially for the parents and youth, they'll be under an hour. Might get longer for care coordinators and supervisors as we talk with them about how it worked and how it could work better. But I don't think we ever want a focus group to go more than an hour for anybody. That would be too long.
Yeah, the current estimate in the IRB is 45 minutes. If we need to move that to an hour for care team, we can, but that's currently what we have.
In those 2 months of the pilot phase, is it recommended the selected individuals not complete the easier Tom? Nope, they can do whatever it is they're doing as part of your normal evaluation. In fact, it could be interesting if we did get some, probably too small of a sample size to do anything rigorous, but we would have no problem with that being done separately. Could do some correlations. But again, that would be probably for a next phase of research, maybe the next grant. And as Tiara says, you can find the slides from this as well as the recording, probably in a few days, at the National Wraparound Initiative website. We'll also put a link to that up on the UW Work website. Leah, just put a pin in that. We'll want to put it up, do a little announcement on the UW Work website and send it to all of our Fidelity collaborators. If the data is stored in RapStat, could you look at one youth's data if they have Wi-Fi, Tom, Dart, and this together? Yeah, I mean, again, all of these things are going to be options. It'll probably be a year or two down the road, but we do want this to interact with all the methods that we've kind of developed and try and make it as streamlined as possible. Could very well be that SmartWrap could be the way you get certain kinds of data. It could be used in combination with other data. But yeah, all that'll be down the road. First, we have to just see if this is feasible and acceptable and see how the data look just as a standalone. So let's see, did we miss any other questions? Guess not. All right, so hopefully we've got all these emails easily being sent to us. Tiara, are we all good with recording all of those volunteers? I'm really, really excited about how many people said they'd be interested.
Absolutely. I have the chat and I will make sure I share it with you all.
Sounds fantastic. Okay, folks. Well, it's always a pleasure to work with folks out there in the field. So many familiar names and some new ones. Thank you all for joining. And yeah, for those who gave their emails, we will reach out. If you want to reach out to us, just hit us at those emails on the screen. And have a great week.
Thanks.